Osborne. I work at Cache Valley Hospital in the laboratory, and I'm a medical laboratory scientist.
What's your job description? What do you do?
When we are in school, we learn hematology, chemistry, microbiology, coagulation, and immunohematology, which is also known as blood and transfusion medicine.
How much schooling do you have to go through to become?
So some students will go 2 years. There's a 2-year degree, and then there's also a 4-year degree. And definitely, we just learn more in depth in the 4-year degree, but it is worth your while and money to get your 4-year degree.
Do you work by yourself or with a team of people?
So I work day shift, and yeah, for sure. Even though we're a small lab compared to what I've worked before, yeah, we work with a team. We're a small enough hospital though that on weekends and nights you are the one and only person, and so is our job here. We also draw patients, so sometimes that's we're in the emergency room, so that's included in our job.
Are you busy your whole shift usually?
Yeah, we stay pretty busy because also we are sometimes included in some of the other upper management. We have some of those responsibilities so CAP is our accrediting agency. It's College of American Pathologists. They come in and they license the laboratory, and so we have to meet some of their inspection criteria. So not only are we doing our job, but sometimes we help with making sure we're ready for accreditation inspection.
What's your favorite part of your job?
I really do like feeling a part when a patient, say you get to see the whole process. That's why I like a small hospital feel. Sometimes you get to see it from start to finish. You follow a patient right in the ER, you draw their blood, you know what the results are, you help take care of them, quote unquote, and to know that you played a part, you were a part of a team, and you're not so separated from the whole process that you don't see the whole picture. That's what I like about being in a small hospital.
What would you say your least favorite part of your job is?
Yeah, inspections. It's like making sure we meet all the criteria.
So what are your typical work hours for the week?
So here at our hospital, we work 3/12s.
Okay.
Yeah, and the night shift will work the same thing. So we go from 6 a.m. to 6 p.m. and then the night shift comes on. We have like a half-hour overlap, and then they go from 6 p.m. to 6 a.m. A lot of other places, sometimes you'll see them work 7-10-hour shifts. So they're on 7 days, they're off for 7 days. Sometimes you'll see 4 10s. Those are some common hours. Okay, so this is kind of where the process starts. Our patient will come in and we'll draw their blood here, and sometimes so also collect urine samples and stool samples. A lot of times the patient will bring that back, but for the most part blood. Sometimes we get nasal swabs for flu, for example. Patient processing of samples right here, we'll put the blood in the centrifuge and spin it down to get the plasma or the serum for the samples here. We've got an area here for our urinalysis and urine drug screens. We also do SED rates. That's inflammation. Okay. This is our hematology area, so we'll actually stain the slides. You see here the stain, and we'll stain the slide and look at it under the microscope. And so sometimes we're identifying cells and stuff, but for the most part, this hematology analyzer is excellent, and it tells us all kinds of cells. So it reads it and tells you what cells they are. To go along with hematology, this is our coag, so clotting times. And then we've got 2 big chemistry analyzers right here. And they're kind of same analyzer, but some tests are run on one, some tests on another. There's a whole bunch of reagents and samples we got for all of our testing right here. We have a blood bank area, so we've got blood products in the freezer and fridge, and then a bar for plasma. And this is the blood bank area right there. And then we also have, this is where we do some of the flu testing, PCR testing for don't do micro, but we do a little PCR. We also do like strep testing, and then this is another chemistry analyzer for more chemistry tests. And that's the majority of our testing right there.
Awesome. Thank you.
We are studying histology, and we're here with our histologist Parker. So I'm going to ask her a couple questions. What does histology do?
They study tissues.
So how much do you make a year?
48 to 74,000.
So how much schooling do you need to go to?
5 years.
How many hours are you going to work per week?
40 hours.
So Parker, do you like being a histologist?